That unmute button gets me every time. Good evening, everyone. We're going to give everybody just a second to kind of filter in, and we're going to get started. Good afternoon and welcome. My name is Lee Gant. I am a part of the member engagement team here at Partners. Thank you for joining us today for our monthly Partners Member Cafe. Also joining us for Member Cafe is Beth Brooks. She is our behind the scenes Zoom guru and question moderator, as well as Kimberly Lambert, who will be entering information into the chat for you guys to copy and paste, making it easier for you. We also have joining us today, Sherry Reese Coda and Angela Griffin. They are going to be available today to help with questions also. Our topic today is going to be the tailored plan launch. Before we get into today's session, we're going to go over a few housekeeping items. First, please note that our session today is being recorded. We are offering today's session in closed caption. If you do not need this feature, it is at the bottom of your screen. You can simply hover over live transcript and click the hide subtitle button. Please do not share any sensitive personal information during this call. Partner staff is available for individual issues you may want to discuss. We will share contact information for member engagement later in our presentation. The recording of this session will be available at our partners website. It is www.partnersbhm.org. You can go under the members tab, select events and trainings. We will also be sending you a follow-up email, and that will contain today's slides. So let's quickly take a look at the Zoom features, which is located at the bottom of your screen. Chat is disabled for this session. The Q&A is open for you to enter your questions as information is being presented to you today. Please feel free to enter questions into the Q&A as they come to your mind. We will go over Q&A after our guest speaker's presentation. You will also notice that you have a reaction button at the bottom. You can raise your hand during the question time. When you raise your hand during Q&A, we will open your mic for questions or comments that you may have. Our guest speakers today are Cindy Troball and Carolina Abello. So Cindy, I'm going to turn it over to you now.
Good afternoon, everyone. Thank you, Lee. Welcome to Partners Member Cafe for June. We are quickly going to go over this timeline. It is being checked off as we go, and you can see that we are quickly approaching tailored plan launch on July 1st. We had some big information happen on June 1st, and I'm going to defer that to later on in our presentation when Carolina goes over our call line information. You'll hear more about the nurse, behavioral health, and pharmacy call lines and much more. But right now we are in that window of getting our welcome packets mailed out to everybody in that blue box there on the right. And so we'll talk more about that welcome packet in a minute, but that's kind of where we are on the timeline. And we should have all those welcome packets mailed out to everybody on by the 13th, and people should probably still be receiving those within the week after that, and have all of that information ready for July 1st for tailored plan launch. Today, we're specifically going to talk about health plan comparisons. So we are going to welcome you today to hear information that hopefully simplifies being able to compare the health plans and reduce confusion. I do want to mention too that when we started sending out information about Member Cafe for today, you probably saw on the flyer that Ann Gluff was going to be your speaker today. And Ann is representing us this week at the Eye to Eye Conference. And so I'll be taking her place. Again, I'm Cindy Trobaugh, Member Engagement Manager with the Member Engagement Team here at Partners. So we want to start off first by kind of understanding North Carolina Medicaid. So Medicaid is a health insurance that's both state and federally funded. Medicaid provides insurance coverage for individuals with low to moderate income. North Carolina Medicaid managed care brought about changes for most Medicaid beneficiaries. Medicaid applications and the eligibility determination process still is handled by the local Department of Social Services in your area, and actual services are administered by the health plans that we're going to talk about today. Medicaid services are the same across the health plans, but some health plans may offer enhanced services. So Medicaid today, as we move forward to the next slide, right now, North Carolina Medicaid moved to a managed care model in July of 2021. And that's when the standard plans launched in July of 2021. That was phase one of North Carolina moving to Medicaid managed care. So the tailored plan launched coming up on July 1st. That's phase two of working into Medicaid managed care. North Carolina Medicaid Direct is a newer term for the current Medicaid plan. So what you've always called Medicaid is now North Carolina Medicaid Direct. Individuals in this plan will continue to receive their medical and pharmacy services with any community provider and have their behavioral health, intellectual and developmental disability, substance use disorder, and traumatic brain injury services managed by an LME MCO, which is a local management entity or managed care organizations such as Partners. The plans manage the benefits, and each plan has a network of providers who will provide the actual services. And we'll talk more about each of these plans. So Medicaid health plans, let's talk about those. On this next slide, we've got this set up in a side-by-side comparison. So we're going to start with standard plans, and hopefully we can simplify this comparison for you here. Standard plans provide integrated physical health, behavioral health, pharmacy, long-term services and supports to most North Carolina Medicaid members. That's a key word, most. Most of the people that receive Medicaid coverage will be in the standard plan. Medicaid members and other programs and services will also be addressed here for unmet health-related needs. Now, standard plans are based on the county of resident where the member lives. So that's a key point there for standard plans. Let's jump over to tailored plan next on your far right there. Tailored plans also provide that integrated approach, providing physical health, behavioral health, pharmacy, long-term services and supports, the same as a standard plan. Plus, they provide more enhanced services to some Medicaid members with moderate to severe service needs and health conditions. The tailored plan is based on the county that manages the member's Medicaid case, not the residential county of residence. If the administrative county changes, then the member will move to the tailored plan that provides services for that county. So in the middle there, Medicaid Direct, North Carolina Medicaid Direct will have medical services are managed in the community. I'm sorry, let me start that over again. North Carolina Medicaid Direct provides medical services that are managed in the community by any Medicaid provider. Enhanced behavioral health services will be provided by an LME or MCO, again, local management entity or managed care organization such as Partners. North Carolina Medicaid Direct is also based on the county that manages the member's Medicaid case. They call that an administrative county. You'll hear both of those terms. So the Medicaid standard plans, again, are serving most of the Medicaid beneficiaries in North Carolina. Right now, more than 2 million beneficiaries are enrolled with the standard plan. There are 5 companies that provide the standard plan in North Carolina, and you can see them here: AmeriHealth Caritas, Healthy Blue, United Healthcare Community Plan, WellCare, and Carolina Complete Health. Now, on this map, you'll notice that the first 4 listed there are statewide and available in all counties in North Carolina. Carolina Complete Health serves regions 3, 4, and 5. And that's represented on this map in the orange, red, and dark green sections there. So on July 1st, 2024, Medicaid beneficiaries who have need for a higher level of mental health, substance use disorder, intellectual and developmental disability, and traumatic brain injury services will move to a tailored plan. Again, this is phase 2 of North Carolina's Medicaid managed care plan. The tailored plan will manage both behavioral, physical, and pharmacy services. There will be some populations that will stay with North Carolina Medicaid Direct, and I'll go over that list in just a second. So to simplify the difference, there's a lot of words on this slide, but I'm going to try to simplify this for you. The difference between a standard plan and a tailored plan, because there are some similarities, right? So standard plans and tailored plans both include that integrated approach. They are both going to provide integrated physical health, behavioral health, pharmacy, and long-term services and supports for individuals in North Carolina that have Medicaid. The standard plan is serving most individuals who have Medicaid because most individuals don't have complex needs. The tailored plan is in place to provide those additional services above and beyond what the standard plan offers to address those complex needs that folks have with mental health, substance use disorder, and traumatic brain injury and intellectual and developmental disabilities. So that's the simplified difference between the two. They're both providing integrated care. Standard plan is going to serve most individuals in North Carolina, but those who have a complex need in their behavioral health or service need or complex co-occurring health problems, they will be served by the tailored plan. There are a few exceptions, and we'll go talk about those on the next slide here. Who will remain with North Carolina Medicaid Direct on July 1st? So we've got a list here for you. This is, again, a basic list. There's more information on the website. Kimberly's going to drop the state website in the chat for you. But the folks who will remain with North Carolina Medicaid Direct include those individuals who are duly insured with both Medicaid and Medicare. When you hear that term, duly insured, or you might hear duals, there's lots of different ways that people refer to this, but what they mean here is folks who have Medicaid and Medicare, duly insured with those two insurances, they will stay with the North Carolina Medicaid Direct, except for those folks who are receiving a North Carolina innovations waiver. If you are in the innovations waiver and you are duly insured, you will still be in the tailored plan because of the need for those services that are offered under tailored plan only. Other folks who will stay with North Carolina Medicaid Direct on July 1st are folks who are in the foster care and adoption program, the HIP program, which is health insurance premium program, CAP C and CAP DA, which is the community alternative program for children and disabled adults. Also, patients in long-term nursing, skilled nursing, medically needy Medicaid program, and legal immigrants. So again, what is Medicaid, North Carolina Medicaid Direct? North Carolina Medicaid Direct is the healthcare program for North Carolina Medicaid beneficiaries that are not enrolled in the managed care plans, which is the standard plan and the tailored plan. So this is as of July 1st. If you are still in the Medicaid Direct plan, because you do not qualify to be in either the standard plan or the tailored plan. North Carolina Medicaid Direct members may see any healthcare provider who accepts North Carolina Medicaid. The medical provider will bill Medicaid directly for each service, and the member may also be eligible for tailored care management with the LME MCOs, again, local management entity or managed care organizations such as partners, or be eligible for care management through a care management agency in the community. So because Partners is going to be a tailored plan as of July 1st, we want to spend a little more time on the tailored plan. And some of this information will sound repetitive because we've gone over it just a little bit here previous, but the more you hear it, I hope that it will begin to make sense and sink in and be simplified by this information today. So again, what is the tailored plan? It is managed care. It is a new kind of North Carolina Medicaid health plan. It will cover physical, behavioral health, which includes mental health, substance use disorder, intellectual and developmental disabilities, and traumatic brain injury services. It's for those who have complex or more intense needs than would be served in that standard plan. If you have North Carolina Medicaid Direct services now for complex needs, your plan will be moving to a tailored plan on July 1st. The name of your plan is changing to the tailored plan, but your services will not change. So who's running the tailored plans? Here is a list of the 4 organizations across North Carolina. In addition to Partners, you have Alliance, Trillium, and Via. These companies right now operate as a local management entity, but as of July 1st, they will be tailored plans. And if your North Carolina Medicaid is moving to a tailored plan, it will be managed by one of these 4 companies. So how will you know if you're in the tailored plan and who's managing it? So here's a map that breaks it up for Alliance, Partners, Trillium, and Via. But back in April, some letters started coming out from the state. You would have received a letter stating that you were going to be moving to the tailored plan, that which tailored plan would be managing your benefits. So therefore, right now you would have gotten that one letter from the state, but right now you should be receiving your welcome packets. So the welcome packets started being mailed out in late May through mid-June. So we're in that window right now where you'll get your welcome packet. And that welcome packet will have information in there again that will tell you who is your tailored plan. It will have a new ID card in there, and clearly right across the top of your ID card, it will have who your tailored plan is. So everybody in our catchment area will have partners on their tailored plan ID card. And a lot of great other information will be in that welcome packet, including a handbook and if you in numbers if you need to reach out to anybody with questions. So the benefits that are available in the tailored plan will be in that handbook I just mentioned, that will be in your welcome packet. We also have all of the handbooks on our website that you can get to. This is just a summary or a short list of the benefits here, but let me go over what some of those benefits are for you. So benefits under the tailored plan will include physical health, pharmacy, and enhanced services for significant or severe mental health, substance use disorder, intellectual and developmental disability, and traumatic brain injury needs. Services also for those in the North Carolina Innovations Waiver and the TBI waiver. The TBI waiver is specific to Alliance right now. We hope that gets expanded, but right now, if you're in the partners area, and those North Carolina Innovations Waiver services will be provided under tailored plan. There will be added services such as wellness programs, and there's also transportation services for non-emergency medical rides to doctor's offices, pharmacies, to pick up medications, things like that. And I believe Carolina will go over some more information about that when we talk about the call lines. Tailored care management continues to be available to focus on whole person care and unmet health related needs. And also we'll talk about this a little bit more in just a second, but state funded services are also provided under tailored plan. So the state funded services under the tailored plan are for uninsured and underinsured recipients. Recipients is the North Carolina Medicaid term for individuals who receive state-funded services. So you'll hear members or recipients. You'll also hear the word beneficiary, but in this case, recipients refers specifically to folks who receive state-funded services. Underinsured means that recipients may have other insurance, but it doesn't cover services that they need, and that might be possible for them to get those services under state funded through the tailored plan. There is a specific handbook for recipients, and it's also on our website at the link that's on our slide here, and I believe Kimberly will drop that in for you into the chat. So again, if you're moving into a tailored plan, here's some milestones on the calendar that we've been hitting along the way. But you would have gotten a letter in April telling you who your tailored plan was going to be, if you're going to be in a tailored plan, and asking you to choose your primary care provider. Then in May 15th, if you had not selected a primary care provider, one was assigned to you, and please know that that is changeable. If you have a primary care provider that's been assigned to you that's listed on that new ID card, that's not correct, or it's one that you don't prefer, you can get in touch with us and change that. Again, in late May through mid-June, we are getting out those welcome packets that I told you about. That's going to have your new ID card in it and your member handbook, as well as some other great information that'll help and who to call. And then we're ready for July 1st. We've been working at hitting this go live July 1st for about 3 years now, and we're finally here. If you have any questions at all, you can send those to us to memberquestions@partnersbhm.org, and I'll put that in the chat for you as well. So what if you need to change health plans? Let's talk about that for a second. There may be a few reasons why someone would need to change their health plan, which maybe they have moved to a new area, they have a different diagnosis or a new diagnosis, or their service needs change. We do have a request to move process. There is a link here. There is a form, a request to move form. There are several different ways that we can help you through this process. We have a team at Partners who will help you with a smooth transition, but you can also go to your provider and they will assist you with completing that form and starting this process for you. So lastly, I want to tell you we've got, in addition to folks at Partners who will help with this transition, there's a list of who to call when here. And again, we'll be sending out these slides. And so the hours of operation and phone numbers or links are listed here for you. But you would want to call your local Department of Social Services or the social services that administrate your Medicaid. Remember, in some circumstances, it might not be your county of residence, but your Medicaid may come out of a different county. So whoever's administrating your Medicaid, you would want to call them if you need to apply for Medicaid, or if you have questions about Medicaid coverage, eligibility, or the recertification process. To update your mailing address. So if you're in Medicaid Direct, you would want to call them to update your and keep that address updated for them, because that's where your Medicaid card is. Keeping that information is your mailing address. To request non-emergency medical transportation, we mentioned that the tailored plan is going to have transportation, but if you are in North Carolina Medicaid Direct, you would still go to the Department of Social Services to book your rides for your appointments. To request a new ID card, you would call them too if you're in Medicaid Direct. For the health plans like Partners, you would want to call us if you have questions about covered services, health plan value-added services, to change your PCP or primary care provider, to request non-emergency medical transportation. Again, if you have tailored plan, you'll be calling Partners or your tailored plan to book your rides. To request a new ID card if you're with tailored plan. The North Carolina Medicaid Contact Center, you'd want to call them if you have other questions about carved out services such as dental service. To change your primary care provider, you can do that as well at that number, just like calling the Department of Social Services or tailored plan. And you have, if you have general Medicaid questions, you'd want to call the North Carolina Medicaid enrollment broker to confirm enrollment in a health plan. So if there's any question about what health care plan you're in, you can call the enrollment broker. If you need to change plans, that's another way you can start that process, is to call the enrollment broker. They also offer choice counseling about the different plans and who qualifies to be in which plan, and can help you with that as well. If you enrolled in a managed care plan but need to keep the services you currently receive through North Carolina Medicaid Direct, you'd want to call the enrollment broker. The North Carolina Medicaid Ombudsman is available if you feel like you're not getting the care that you need. If you have questions about a notice or a bill that you have received, or if you have already talked with your healthcare provider or your health plan and have not been able to get your problems solved, that's what the ombudsman is there to help with. And if you have any questions about the complaint or appeals process. So we've given you a lot of information today. We hope we've cleared some things up as far as the differences between the health plans. And now I want to turn it over to Carolina Abello, who's going to speak with you about the member and recipient services call lines. Thank you.
Thank you, Cindy. Good afternoon, and it's a pleasure to be presenting to you all the information about our lines. With that slide that Cindy showed, if for some reason you still don't know where to call, you can always call our member recipient lines, and we will transfer you to all of those places that Cindy mentioned. You can call our member line, and we will warm transfer you to DSS if that's an issue with your ID card or with your address, or we can transfer you to the Medicaid contact center. So that's exactly what our member line does. It tries to simplify and doing a warm touch with a transfer from our queue to any place that you need to, talk or reach. It can be another department from partner. So if you move to the next slide, the member and recipient line opens Monday through Saturday, 7 a.m. to 6 p.m. So we make sure that we have some hours if you are an early bird or if you want to reach us until 6 p.m. We have a closed menu that you can also reach out some services within the closed menu. You can always transfer into the crisis line if you're having a behavioral health crisis and you need to talk to somebody right away. That member line, even after hours, offers a transfers to the crisis line. But we also have other options in the closed menu, like our nurse line that is open 24/7, our pharmacy line that is open 24/7, and even transportation, because there's some after hours. If somebody's discharged from a hospital and needs transportation, that will be available to you as well. The crisis line, and I'm sure that if you have our welcome packages, you have these numbers already, so I know that you're seeing them on the screen. Make sure that you save them in your phone so you have them ready to go. Our crisis line is open 24/7, and if you go to the next slide, I'll talk a little bit more about what does our crisis line do. It's answered by licensed clinicians. We also have some registered nurses and licensed social workers. And we operate 24/7, so it never closes, and it doesn't have an automated answering like an IVR choice, like a menu, right? It's a live answer, so they will always assist you. It has an option in the beginning if you need Spanish or a family member needs Spanish or you know anybody that doesn't speak English. We also have access to 200 languages through interpreting services. So our behavioral health crisis line connects you to emergency crisis, emergency dispatch with mobile crisis, can help you find a provider in your area, can help you transfer to a provider if you need an appointment, can help you decipher what type of provider you want to see, or if you need to talk to your care manager and you want us to transfer you to the care manager. We also, in the member line, I'm going back to the member line, so let's see, let me go to the next slide. In the member line, you can, all of those different things that Cindy was explaining, all of that can be managed in the member line. If you need to change your PCP, if you have questions, who is your tailored care manager? If you want to, transfer to a provider or coordinate an appointment, any of those questions, even a claims question, all of those different things. If you have housing needs, any type of resource in the community, we can answer all those questions. We can also take grievances. We can also look at claims and transfer you to the claims department. And we have the tailor plan lines that are our nurse line, a pharmacy, and the transportation, as I was explaining. Now, those will be options in the menu. So you can listen when you first call the member line, different from the crisis line. It does have a menu. So the crisis line will always answer live, will never go to a voicemail. The member line, you will have a menu. And in the menu, you will have then these options if you are tailor plan. Now remember, if you're Medicaid Direct, you can have other options, or our team can transfer you to who can help you. If you're Medicaid Direct or even Standard Plan, we can transfer you to your Standard Plan member services line. We can transfer you to DSS if you're Medicaid Direct and need transportation. But if you're Tailor Plan, you will have these options in the menu. And the menu will say Tailor Plan Nurse Advice, Tailor Plan Pharmacy, Tailor Plan Transportation. So if you need transportation, just know that if you have a provider that you have a lot of appointments, like recurring appointments, you're going maybe once a week or something like that, you can also let your provider know to contact the provider assistant transportation line, and it's part of our provider line menu, and they can set up all those appointments for you with the transportation service of Mobit Care. So just I wanted to mention that. I know that it's not going to come in the slides, but I think Kimberly's going to put that information for the provider line. So if you do have a recurrent appointment, just ask your provider to assist and schedule all those appointments through the provider assist option in our provider line. In the member recipients, as I said before, you also have a claims option, a housing option, and if you need to talk to a care manager that is assigned to you, you will be able to transfer to them as well. The next slide. Our member services lines are answered by qualified professionals, and they generally handle non-emergency issues. So just know that if you call the member line and you do talk to one of our staff and you are in crisis, or you need any enhanced services, you will probably be transferred to a licensed clinician that will be able to assist you further. They'll be able to do a screening. They'll ask you if you're in crisis, what type of services you need, and if you need them right away. Like mobile crisis will be a 2-hour response for a mobile crisis unit to arrive to screen you and evaluate to see how they can help you and connect you with a provider. And I mentioned the voice. There is a voicemail, of course, that you have access, but there's also the transfers in the closed menu to the crisis line and to those lines like pharmacy and nurse that are open 24/7. If you go to the next slide, thank you. And okay, I guess this one is a sliding feeding. There it goes. So I mentioned several already, but as you can see, we can give you a lot of information through our staff that answers these lines. Resources, what are your benefits? If you need any help with selecting or changing your primary care physician and you're part of Tailor Plan, and if you need to schedule any type of healthcare or appointments or walk-ins, remember that if you are Medicaid, there's some things that will transfer you to those proper places where they can assist you having that type of coverage. Our qualified professionals will always check in a system that is called NC Tracks, and it lets us know what type of plan do you have. So even if you call and you at the time maybe don't have your ID in front of you, don't worry, our staff can look up and they will always HIPAA verify you, okay? And that's for your protection, is to make sure that your information is protected and that we're talking to the right person. So they will ask you like your date of birth, they will verify your address, they might ask you the last 4 of your social, and that's to make sure that we are looking at the right person in the system and that we're giving you the right information, making sure that we're taking care of you and sending you, if we have to transfer, to the right place, correct? And I'm going to the next slide, if that's okay. So the nurse advice line is part of the Tailor Plan benefit, and is a line that is also open 24/7. It has a very small automated service, but immediately connects you to a live nurse, and they will triage if it's a urgent type of call, or they will give advice of they will give you like a plan of what's the next steps to take, but they will not like diagnose you, but they will kind of give you their opinion, right? Their advice, as the line says, nurse advice. So they were triaging, and they will give you information of what to do next. You know, should you really go to the ER right away? Will you be okay at an urgent care, or things like that? So thank you for the next slide. So they will educate you about conditions. They will assist you in improving your self-management, like if you're taking certain medications, or having certain symptoms. They will coach on managing any non-emergent behavioral health. But most of behavioral health, the nurse will probably transfer back to our crisis line that has the licensed clinicians that specialize in behavioral health. So just know that if you do call and you are having a type of crisis with behavioral health, and you chose the nurse advice line, they might transfer you back to the licensed clinicians in our line. So they will coach on acute medical concerns, trying to avoid the emergency room if that's feasible. And they will educate on any prevention and health programs that they can offer you. They will help you to navigate resources and inform you of resources. So just know that the nurse advice line is part of the menu in our member services line. And if you go to the next slide. Non-emergency medical transportation. This is another of the benefits of the Taylor plan. Just a reminder that if you have Medicaid Direct, you will still coordinate your transportation through the local county Department of Social Services. But if you have Taylor plan, this will be an option in our menu, and you can transfer to their line to coordinate your rides. Right now, the line is open, but the rides that are coordinated start on July 1st. So if you have any rides from here until before July 1st, you still need to continue doing those through the local county DSS. But they will take scheduling the rides that start on July 1st. So the line is open right now. And I'll go to the next slide. Thank you. So how does non-emergency medical transportation work? You make an appointment with your provider, and then you book the ride to that appointment by calling our member line, or you can also call the transportation line that you see in your ID card. They will also do different other vouchers, like if there's train available, a taxi. It takes 2 days, 48 hours they request to schedule the ride. If you have something that popped up at last minute, like a last minute appointment, or you have to go pick up this medication and you did not have 48 hours, they do have some exceptions for that using Uber and Lyft, and you will still call them to book that. It's not something that you will book it, but they will book it for you, and they will cover, of course, all those expenses for you. And there's also other travel reimbursement options as well. So the transportation line will also appear in your ID card, and of course is part of the choices in our menu within the IVR. And I'll go to the next slide. So finally, but not least, is the pharmacy line. And the pharmacy line, you will have, again, in the card, it says prescriber number, okay? It doesn't say pharmacy. So sometimes it's easy to look at the card and say, well, I don't have the pharmacy number. And I know this because I did that. I looked at the card and I was like, it's not there. It says prescriber. And it's covered medications. You will call, and they will, help you to find the right information and to make sure that you can have all your medications covered through the plan. And they will help you also to make decisions about your prescriptions, or give you the information about different symptoms, etc. And I'll go to the next slide. So just to recap, our 3 main numbers are the member and recipient services. Remember that line has that menu, and that menu connects you to the pharmacy, to transportation, to the nurse advice line, but also connects you to other departments within partners. The crisis line It's a live answer. It doesn't have a menu. It only asks you if you're English speaker or Spanish speaker like me. I'm sure that you already noticed my accent. And then the provider line is for providers. So providers that are serving our members, and it has different options for them. And it has that option for transportation that it's important. If you have an appointment that is recurrent, ask your provider to call this number, the 877-398-4145, and the provider assist transportation option will allow him to book all those recurring appointments for you with MovidCare. So I think that is my last slide. I hope that this was helpful. And I go back to Cindy, is that correct?
We're going to open it up for question and answer time right now, and I think Beth's going to help us with that.
I'm going to give our panelists just a moment to be prepared to be back on camera. Okay. We have a couple of questions in our Q&A about the slides, and yes, we will be sending a PDF of the slides out to all of the people who registered and who are attending today. We do have another question in there. It says, if someone has a standard plan but needs Medicaid Direct, what is the process for moving to the needed plan? And we had those slides in there. And if you want to come off mute, if you did not get your question answered through the slides, please feel free to. Or Angela, do you want to add anything to that?
That's what I was going to say. So I'm Angela Griffin. I'm the member operations manager, and I also cover our transition of care team, which is changing health plans. So just a little additional information about that process. There are two ways that can be complete. Well, technically three, but two ways that can be completed. So the first one is that you can have the beneficiary can complete what's called a beneficiary request to move form. And that would be that would not be effective until the first of the next month. The second way is for the provider to submit the request to move form, and I will drop in the chat the link to submit these forms online. You can do with the provider form request, you can either do a service associated request, which means you actually submit a SAR with the form. Those requests will take place within 24 hours of the time that they are received. Those changes, the member will be changed to Medicaid Direct. If it is a non-service associated request, it will still it still will not be active until the first of the next month. So the service associated request makes it kind of a more immediate process. Okay. And if you have any questions about that, you can also reach out to our transition of care team. We have a email distribution list. It's toc@partnersbhm.org. And you can also reach out to the enrollment broker, which is 833-870-5500, which I think was already placed in the chat. But I will go ahead and place in the chat the link where you can submit the request to move forms online.
Don't have any more questions in the Q&A, please feel free to add them to the Q&A, or you can raise your hand and I can unmute you. But we don't want you to end this session without all of your questions being answered.
We had a few questions that were submitted ahead of time, so we thank you for doing that. Some of them were from providers. Sherry Reese-Cote is on with us, and Sherry, do you want to let the providers know if they still have questions after today, how they can get in touch with Provider Network to get their questions answered?
Sure, I can do that if I can get off of mute. So I think one of the questions that was sent in prior to today's meeting was how do I make sure if I have a physical health provider that they're contracted with Partners Tailored Plan. So if you have that question, you have somebody you've identified with one of your members that has a physical health provider that's not in the network, want you to reach out to Jaleesa Cole, and her email is jcole@partnersbhm.org. And Jaleesa can help you guys navigate to the physical health network to be able to connect and make sure those providers are brought into the network. If you're a behavioral health provider that is in the Partners Health Network, you can always reach out to PAS at Partners, BHM, I'll get it out in a minute, BHM.org to ask us any questions, or if you don't know who your assigned specialist is. And then, as always, we have the provider service line that Carolina covered that you guys can connect with or call if you have questions and you don't know where to start. And her team will transfer you to where you need to go or triage or assess and help with that. So that's all I have. Is there any more questions for me?
That was really helpful. Thank you.
I will leave one note. Tomorrow is provider forum at 1 o'clock. If any of the providers that are here today would like to attend that for more information, you can find the registration link on our training website on the partners website. So thank you.
Thank you. There was one other question submitted ahead of time that were it reads effects of the tailored care on innovations waiver. And I'm not sure exactly what the question is, but I'm going to try to answer what I think it might be. Feel free to, if you're online and you want to provide some clarification around that. But any current member who is a recipient of the North Carolina Innovations Waiver will be moved to the tailored plan on July 1 automatically. So tailored plan services or innovation services are offered through tailored plan. So those folks will move. We mentioned earlier if folks were duly diagnosed or duly insured, with Medicaid and Medicare, that they would stay with the North Carolina Medicaid Direct. And the exception is if you are a innovations waiver recipient, you would still be served through the tailored plan. They will manage your benefits. So I hope that answers your question. If not, please feel free to provide more clarification in the Q&A, and I'll hope to answer your question.
And they won't have any disruption in services.
Thank you, Beth. Yes, they won't have any disruption in services. You have a tailored care manager that helps you with those services. And if you have any questions, we would refer you to your care manager within Partners, or you may have a tailored care manager through a community agency, but we would refer you to have your questions answered through your care management agency. And of course, like Carolina said, if you have any questions, the member and recipient service line is available, and we will warm transfer you to the right place and assist you through this transition.
Don't see any more questions. And Kimberly, you've put the link to the provider forum in the chat. Is that what that is? Perfect. Perfect. So if anyone, this is your last chance to ask questions to us. and get your questions answered live, you can raise your hand and I can unmute you, or you can drop your question in the Q&A. All right, I'm gonna share my screen again. And we will have Lee close us out with some final information.
So as always, we asked you guys to stay in touch with us. How you can go about doing this is to keep your contact information updated. Partners may need you to contact your health plan to do so. If you receive Medicaid, you can contact your local Department of Social Services to update that information. If you receive state funds, you can contact Member and Recipient Services at 1-888-235-4673. You can stay connected with us. Do you guys want to learn more about Partners news, upcoming events, and training opportunities? Whether you're a member or provider or someone with an interest in behavioral health and intellectual and developmental disability care, we welcome you to click subscribe to sign up for emails from Partners. Your feedback is very important to us as well. We're going to take a moment right here and let you guys scan this and complete our survey, if you would, please. So we have went over questions and comments, so I'm going to close this out. I would like to say thank you for attending Member Cafe today and sharing your time with us. As I mentioned at the beginning of our session, partner staff is available for individual issues you may want to discuss. You can reach the member engagement team by sending an email to memberquestions@partnersbhm.org. I hope you guys completed our survey. The topic for next month's Member Cafe is Tailor Care Management. I would like to thank all of the ladies on the panel today for the information they have provided for us, and thank you guys for joining us, and we hope to see you next month at our next Members Cafe.